Welcome to our video on lower abdominal pain differential. Let's get started. This scene will take place at the beach on a nice sunny day. One of the beachgoers doesn't look like he's having a good day at the beach as he clutches his lower abdomen. This man holding his lower abdomen should remind us of lower abdominal pain, which is the focus of our story. But how did our friend get here and why does he have lower abdominal pain? Perhaps he ate some bad food from this food vendor. Looking closely, we can see that this food vendor is roasting nuts to sell for extra fun on the beach. The nuts are enclosed in a bag, resembling testes in a scrotum. The roasting bag of nuts should make you think of orchitis, which is inflammation of the testes and a potential cause of lower abdominal pain, as well as epididymitis. These conditions are often associated with urinary tract infections that go untreated for a while. Treatment consists of scrotal elevation, antibiotics, and NSAIDs for pain control. Not everyone at the beach is having a rough time though. We can see this little boy having some fun playing tetherball. If we look closer at this tetherball, you'll notice that it resembles a testicle attached to the epididymis above. This ball is tethered to the pole, which resembles the spermatic cord. Also notice that as he hits the testicular-shaped ball, the ball and rope get twisted. This idea should remind you of testicular torsion, which is another cause of lower abdominal pain. This is an emergency because it compromises the only blood supply to the testes and can result in ischemic necrosis of the testes. It commonly presents with testicular and lower abdominal pain, in addition to an absence of the cremasteric reflex on physical exam. While the kid enjoys himself with the tetherball, his dad over there is keeping an eye on him. He couldn't play with him, so he decided to sit in the sand by a fire. As you'll notice, this dad is obese and his large abdomen has two large bulges. One in his belly button, resembling an umbilical hernia, and one close to his thigh, resembling an inguinal hernia. This idea should remind you of a hernia, which can also cause lower abdominal pain. There are several types of abdominal hernias, including umbilical, direct, indirect, inguinal, incisional, and Spigelian. Reducible hernias are often monitored without surgery, while irreducible or incarcerated hernias require surgery because they're more prone to result in a compromised blood supply, known as strangulation. Now here comes the next member of his family. The daughter is wearing a diver suit and came to the beach to draw. Unlike her father, she doesn't like to sit in the sand, so she brought a chair. Her chair, however, looks like it's seen better days. As she sits, the seat underneath her breaks, and now her bottom is bulging through that break. The outward bulge in this chair should make you think of an outward bulge in the colon, known as a diverticulum. And to drive this point home, remember that she's wearing a diver suit, which should remind you of diverticulum as well. Diverticulosis is marked by multiple small outpouchings in the colon, predominantly seen in the left colon. Now, notice that some of the fire has spread directly underneath her bulging bottom. This fire idea should remind you of diverticular inflammation, known as diverticulitis, which is another cause of lower abdominal pain. Often, mild diverticulitis can be treated with antibiotics and supportive care, but will need surgical intervention if colonic perforation occurs. As the diver girl falls through the seat of her chair and feels the burn below, she drops the pen used for drawing. Notice that the fire has consumed the pen, and now she won't be able to draw anymore, at least for today. Notice that her pen is shaped like an appendix. The word pen sounds like appendix, and the fact that it's on fire, a recurring symbol for inflammation, should make you think of an inflamed appendix or appendicitis, which again is another cause of lower abdominal pain. The pain typically starts at the periumbilical or epigastric region and then migrates to the right lower quadrant area. Now let's talk about some causes of lower abdominal pain that occur only in females. To help us with this, we're going to see what this diver girl was drawing before she got stuck. She was drawing her mom who was lying in the sand under the umbrella. Looking closely, we can see that her mother is pregnant and is halfway lying below her umbrella. A pregnant woman half inside and half outside of the umbrella should remind you of ectopic pregnancy. Ectopic pregnancy is a cause of lower abdominal pain in women and occurs when an embryo implants outside of the uterus and causes pain as it grows. This condition becomes an emergency if it ruptures, so it's an important cause of pain to recognize. But why did the mom and the family choose this spot on the beach in particular? Looking off into the distance, we can see a beach shack with a fancy female reproductive shaped chandelier and candles hanging from it. What a nice place for families. Anyway, this idea should remind you of upper female genital tract inflammation, or pelvic inflammatory disease, which is known as PID for short. And again, this is another cause of lower abdominal pain. PID is often caused by genitourinary infections, most commonly Neisseria or chlamydia, and can cause serious complications like a tubo-ovarian abscess and scarring if left untreated. We've been on the beach for a while, but we haven't seen beach volleyball yet. So let's bring that in. This girl wanted to play volleyball, but didn't come prepared. So she picked up an old, broken tetherball she found lying around. Notice that the tetherball resembles an ovary, and the rope looks like a fallopian tube. She thought she could use that odd tetherball as a volleyball, but soon realized her mistake when the ball entangled around her as she tried to serve it. The twisted ovarian tetherball should remind you of ovarian torsion, which is another cause of lower abdominal pain in women. Much like testicular torsion, ovarian torsion is a problem because it compromises the blood supply to the ovary. Another girl is squatting down, trying to return the serve, but she got distracted, and now we can see this pink ball hitting her in the abdomen. The pink volleyball hitting her belly is shiny and semi-translucent, much like an ovarian cyst, which is a common cause of abdominal pain in females. An ovarian cyst is a sac filled with liquid or semi-liquid material that arises in an ovary. Ovarian cysts are benign in the vast majority of cases, which is why they're mostly asymptomatic and discovered accidentally. However, they can be malignant as well. Although benign, they carry other types of risks, like ovarian torsion and rupture, which can also cause severe pain and peritonitis. Now let's take a look and see what made this girl distracted in the first place. It's the summer sun that reflected on those metal poles in the surrounding water, causing this shimmering on the surface. These poles were left over from a water volleyball game days before.
The water has pulled the net away, so only the metal poles are left.
Metal pole shimmering sounds like Mittelschmerz, a cause of lower abdominal pain in women. Mittelschmerz is a condition characterized by pain with ovulation and is often treated by regulating menstruation with birth controls and providing pain control with NSAIDs. It must be time for low tide at the beach, as we can see corals growing up from the sandy ocean floor. These red corals are shaped like the uterus and have some sand stuck inside that looks like fibroids, reminding us that uterine fibroids can cause lower abdominal pain as well. Fibroids are usually a benign condition, but they can cause bleeding, pain, and fertility problems in some cases. With all of those people around, there must be a place where they can answer the call of nature. Close by the corals, we see a porta potty with a man outside waiting his turn to enter. The door on the porta potty is closed, and the man outside cannot enter to do his business, so he's holding his belly in pain. This closed porta potty should remind you of constipation, a common cause of lower abdominal pain. Constipation can have many causes, including but not limited to dehydration, obstruction, and poor neurologic motility. It will often present with episodic colicky lower abdominal pain relieved with bowel movements. While an adult can handle the pain and wait, a child won't. This young boy decided to go the fast way and pee close to the porta potty. This peeing kid represents urinary tract infections, a common cause of lower abdominal pain. UTIs are most commonly caused by E. coli and frequently seen in females due to the shorter length of their urethra compared to males. UTIs can be classified as a lower UTI, like cystitis, which can present with dysuria and a desire to micturate despite having an empty bladder, or like pyelonephritis, which usually presents with UTI-like symptoms as well as fever and CVA tenderness. All right, with that, we've covered everything you need to know about the differential diagnosis of lower abdominal pain.